Well, I think based on Solo 1 and Prima, which was presented at this ESMO meeting, certainly primary maintenance with PARP inhibitor following platinum-based chemotherapy in women who have a BRCA mutation is clearly is now a standard. I think the question is in women who are HRD positive, what is the effect in those women? There is some advantage over placebo, but not as great as with patients who have a BRCA mutation. So I think those studies have set a new standard. And then in secondary chemotherapy for recurrent platinum-sensitive patients, PARP inhibitors also have a role in terms of maintenance following platinum-based chemotherapy. And again, they're most effective in patients who are BRCA positive, but also somewhat effective in patients who are HRD positive.